Two files on my desk, yet another 2 deaths amongst the many sudden deaths that we have had since the beginning of this year. These 2 cases were separated by a period of nearly 8 weeks, but I thought it's convenient to lump them together as they both share something new in them that makes them stand out from the rest of the cases I have been asked to review. Indeed, it's the very first time that we are witnessing the advent of what seem to be more modern medical interventions or investigations to treat an animal in allegedly dire straits. So gone are those ramshackle clinics with a sign, often bearing a verifiable name, unprofessional-looking vets and pointless anal probing, the last of which we could do without definitely. In comes what looks like a proper establishment with X-ray and more invasive treatment facilities, manned by people who seem to know what they were doing. However, we don't get to see the building, the name of the practice nor the actual vet anymore. It seems a more proper vet clinic has suddenly materialized out of thin air in or near the city of Siem Reap in the last 2 months. This new place does not look new but seems to be better equipped. This episode is filled with intrigue, often of a darker nature. To enjoy this episode one would require some grasp of basic arithmetic, human anatomy, physiology, pharmacology and radiation physics. But don't worry, I would fill in those bits as we go along. You would understand this episode better if you had seen the other 4 related videos in this investigative series before, but it is not a prerequisite in order to watch this episode. Furthermore, the language in this episode could be a bit blunt at times, but please do excuse me. It is understandable, however, had you watched the other 4 related episodes before. Are you ready? Let's roll! Hold on, why did you blur out the name of the supposedly vet hospital? What is so secretive about this place? Is it because you don't want your viewers to check up on this alleged animal hospital that has suddenly sprung up? If this place does exist indeed, why did you and your friend, Booth, who knows better as he works in the healthcare sector, didn't bring Janet to this place? And chose indeed this place? Given that you guys were earning on average around $500 to $1,000 per channel, and many of you own half a dozen such channels each, and there are at least a dozen of you working together as a team, and with the donation that has been pouring in since the lorry saga, why did you skimp on the proper care that Janet should also deserve? Or indeed Lori herself after she was injuring herself again and again, but you still brought her to the same vet who couldn't even get his dosage right? Not to mention the many monkeys you had rescued just this year alone. Where did all the donation money go? How come none of these injured or sick monkeys ended up at this vet clinic that has suddenly come out of nowhere? If this place genuinely exists, who is this vet manning this place? And if indeed he or she is legit, why did you have to distort the soundtrack to hide what's really going on in the background and blurring out this place's name? And none of the usual fanfare that you usually bring along to visit a vet in the past. First thing first, we all know that there are only 2 qualified vets as we understand in developed countries in the Siem Reap region. One is Dr. Julia Stenkat from Germany working at an animal conservation center outside Siem Reap, the other is a Kiwi Dr. Trish Johansson, running her own private practice in town. I think his name is Thy Bunther, whom they brought Janet to at Alk Hoc C Veterinary, has only a bachelor degree in marketing from the local university according to his resume on his Facebook page, so it pretty much sums up that whoever they alleged is a vet is probably not a vet at all if they aren't Caucasian-looking females. They will have their local breed of vets, but they won't be available until 2021 at the earliest, as the country's only vet school at the Royal University of Agriculture in the capital Phnom Penh was set up only in 2012 and it didn't open its door until 2015. The course will take 6 years, so you could do the maths. And even they will only be able to treat farm animals. That's the stated objective of the course. Oh yes, she did, but just not an animal one. And the clue came from Lissa's treatment video, which I was asked to review, and I think it probably is the right time to do so. This is Lissa on that fateful night after they caught her and brought her to her alleged vet clinic for treatment. We were never shown who that alleged vet was, nor did we get to see the actual consultation or examination that should have taken place. Very different from all the fanfare they did with the previous rescue missions. Indeed, in those videos, they would show us who the vets were, how the vets examined, and even let them explain to us in Khmer too. And Janet was the last video they did it this way. I am not sure why, but it probably had something to do with my video examining the state of veterinary medicine in Cambodia, published in early October. Basically the only qualified vets practicing in Cambodia are all expats from Western countries, and in the city of Siem Reap, there were only 2 as we mentioned before, and they have both declined to get involved with them. And with viewers becoming more aware of the vet situation in Siem Reap, it's hard to sell their videos featuring someone local as a vet when everyone knows that person is acting beyond their expertise. So instead we would just showed a video of someone treating Lissa in a setting that looks like some kind of a clinic. There's no more any fanfare that used to go with these videos, but there's still plenty of these people around taking videos though. That's a real flashback though, so this person knows what he was doing. He's probably a nurse. But what happened next however showed that he's just that, and not a very experienced one either. He was just paid to set up a drip. And he let the drip run too fast a rate at nearly 2 drops per sec, in a standard setup meant for adults. And that's 1 liter of fluid there we are speaking. And the bag is emptying fast too. So the drip is delivering at between 6 to 12 milliliters of fluid per minute into her bloodstream. Too fast a rate for even an average human newborn weighing 3.5 kilograms, which only needs 0.25 milliliters per minute. So she was receiving between 20 to 40 times her fluid need if she indeed weighed 3.5 kilograms, but we know she hardly weighed over 1 kilogram as she was a long-tailed macaque. So in actual fact she was nearly 100 times overhydrated. For an animal that's small, approaching the size of a very prematurely born baby in humans, no medically trained person in their right frame of mind would have chosen an adult IV drip setup in the first place. One would have in the very least opted for a pediatric micro-drip setup, if a more reliable electric infusion system was not available. A preemie in humans weighs 1 kilogram will only have about 100 milliliters of blood, and Lissa had less than that. Do you realize how an insane amount of fluid they have already given to her in the first 5 minutes alone? 30 milliliters using the lowest estimate, approximately close to half of her blood volume. Her heart would definitely begin to fail within the first 15 minutes or so. IV fluid could kill. There is always a saying in surgery that if a person could eat and drink normally there is no need to prescribe IV fluid. Did Lissa lose close to half of her blood volume in the first place from that bite? If she had, she would have been dead already there and then, given that a human would die after losing 40% of blood.
No.
There was no doctor, it was just a show with some laymen directing it. Not to mention that my strong suspicion that it was a setup to get Lissa injured in the first place. Someone had taken her and put her into a young adult's territory to begin with, otherwise she wouldn't have appeared so scared in the first place all by herself alone. It's easy to take a small monkey around, a yearling like Janet could be dealt with easily with a lotus seed. A small baby like Lizza didn't stand a chance, especially since her mum was suddenly gone, reported to have been culled, which I very much doubt. And they wouldn't mind to hurt another monkey to get the subject. Just for making up content for their videos. Look, who's that person ready to throw a stone there? More, he had 2, not 1. As projectiles they could kill a small monkey in a throw. And that's both there. No wonder her condition deteriorated that rapidly that evening, so much so these cameramen had to rush to take her to WLA to wash their hands off it. They didn't want her to die on their hands. It would never look good. but she died shortly after arriving there. She had developed acute congestive cardiac failure with pulmonary edema amongst other organ failures too, such as kidney. Her lungs would be so soaked in fluid that she could hardly breathe, and that could have misled WLA to think she died of a lung injury. But in actual fact, she died of someone playing doctor again so that someone could profit from these dramatic rescue videos. Such gross medical blunder could not have been the work of a doctor. It was of someone who has some knowledge of medicine and was playing with it. Another piece of evidence that this is not a vet clinic was from the drip stand they used there. Did you see that? No, again. It's a half-empty bottle of YC-prazole that obviously had been administered to someone from before using the same stand. YC-prazole is a cheap generic version of a drug called lansoprazole. Its intravenous form is used exclusively to treat humans with acute hematemesis, or vomiting blood from conditions such as erosive esophagitis or peptic ulcer amongst other things. So unless this was a mixed clinic for both humans and animals, my guess is that this place is a treatment room in a normal hospital. This is no vet clinic, nor is there ever a vet. It's just a stage by borrowing a rarely used treatment room in a hospital to shoot these feel-good videos. They even got a comatose dog to try to convince us. God knows what sedatives they had used to make this dog pass out. But then they don't seem to care, as they had used puppies and kittens before for their monkey videos. They could almost fake everything except a real vet and a real clinic. Hence we don't see them showing us an actual vet nor the exterior of a place anymore. Because we know there are only 2 vets in Siem Reap, and they are both Caucasian females, and we know their faces. So someone with a connection to the healthcare sector is helping them, who themselves is not a doctor. My guess is it is Sochin's teammate, Buth, as he has stated on his Facebook that he works as a nurse educator. So they could borrow a room and probably paid someone to put up a drip, but it's just all a show. Ideally they could have used Alk-Hoc-C, but it's already been outed, so they had to use something else, probably more expensive, to stage their treatment videos. Corruption is rampant in Cambodia. Most people don't mind to make an extra buck abusing their position. That's something that the founder of a string of Cambodia's most trusted hospitals, the late Austrian Dr. Richner, had noted. Here's what their website says about how they had overcome it themselves. Now think of some smaller government or private hospitals, where there are a few dozens in Siem Reap. And these cameramen are loaded from earnings they have from their ad money and other donations. Consider that as production costs, which they will recoup many times over with their rescue videos. Anyway, in my former professional life as a general surgeon for nearly 4 years in a district general hospital before I decided to specialize in another field, I had ordered and read over nearly 1,000 abdominal X-rays for patients coming in with acute abdominal pain, and not once would I dream to be able to tell a retained placenta on an abdominal X-ray alone. We use X-rays to detect basically abnormal calcifications or air fluid interface pattern to aid in our initial working diagnosis. Think about white as bone, and dark as air. Anything in between represents soft tissue. Here's what this X-rays of Dolly stands for. So this should what a proper doctor would have interpreted in this otherwise useless lateral abdominal X-ray, which many surgeons would not have ordered indeed. Let's look at a proper abdominal X-ray, or what we call an AP view, with Dolly lying down. Not ideal, but it's better. And you could tell the person holding the abdominal X-ray is a layman, as he was already holding it the right way up. The L represents the patient's left and should be examined as such. But this person flipped it over, so we are now seeing the X-ray the other way round, with Dolly's heart on the right instead. So now Dolly has a very rare condition called dextrocardia instead, a 1 in 10,000 occurrence in humans. Applying the same basics we have used just now, let's see what this X-ray actually stands for. Mind you though, everything will be reversed though, as this person doesn't even know how to handle an X-ray properly. Basically there's a lot of air bubbles in her large bowel. The most prominent one we saw earlier is actually located to the left just above the pelvis. Judging from its position, it's air in a part of the large bowel known as the sigmoid colon, known so because of its S-shape down in the pelvis. This is a very normal place for finding a lot of gas in an abdominal X-ray or indeed throughout much of the large bowel. This gas would have been passed out as flatus eventually had Dolly survived. Basically it just shows that Dolly was literally full of shit and is constipated as such. Oh well, they eat non-stop all the crap the cameramen feed them, don't they? Yep, you were pointing at some shit on an X-ray the wrong way round and you were literally talking crap too. Had my junior called me out from theatre to come and see a patient with this X-ray, I would have strangled him right away. Get on with your headlamp and use a speculum to examine the birth canal instead. Anyway, we are dealing a moot point here, as long-tailed macaques don't die from a retained placenta in the first place. They could drag around it from 5 days to 1 month without falling ill with it. It's never a medical emergency, unlike humans, and if her baby was born healthy, that already was a strong indicator that there had never been an issue with this labor in the first place. And these are post-mortem X-rays. No wild animal would lie still long enough in front of an X-ray machine with a film cassette behind it without moving a single bit. Think of them as kids who don't understand. Hence there was so much gas appearing in the large bowels. The bowels hadn't been moving for a while as their owner was dead for a long while when this X-ray was taken. Oh yes, Sochin, who is that vet and where is that clinic? Why so secretive about it with a video like this? What's more, you and those who had aided you in this fake video had put many patients using the same facilities at risks of zoonotic infections by contaminating a hospital environment with a wild animal. This is a very selfish act to cover your ass. You could see Dolly was very well indeed in captivity. She was feisty and didn't want to be caged. But her fate was sealed when that fake vet had done an injection. We don't know what that yellow liquid was, but I don't think their intention was to kill her. That probably was just an antidote to reverse any remaining effects of something they had given to her earlier on to make her drowsy and almost unresponsive to justify yet another rescue mission. We had seen this string of post-labor drowsiness and eventual death with monkeys from the other production team in a neighboring province under the direction of this guy. Almost 3 in a row, one shortly after another. So now it's Sochin's team to try it themselves, except they didn't want to kill her. They used a lower dosage to drug her to create an excuse to take both mother and baby for the studio production at this fake NGO, run by the same people whom Wildlife Alliance, Dr. Stenkat and the vet at Animal Mama Clinic had a poor opinion of. What they didn't know was that the antidote could be lethal too in the wrong dosage. My guess is that they've been using a liquid opioid like oxycodone to drug these animals. The antidote they used was likely to be naloxone. A naloxone overdosage could cause severe effects on the circulatory system and the central nervous system, which could prove fatal. By the way, don't miss out on the movie Knives Out. Its plot also includes opioid and naloxone, and it is seriously one of the wittiest and funniest movies of this year. It's a shame that everything could be bought over the counter in Cambodia without a prescription. After all, that's why it's a top drug tourism destination. Lastly, I would like to draw your attention to the many fake orphanages in big tourist cities like the capital Phnom Penh and Siem Reap in Cambodia. Basically what is unfolding in front of our very own eyes is one too involving non-human primates. The mysterious cull, the building of a facility to house them, and the money involved in it. And I certainly wouldn't put animals into the care of someone who, after observing them for nearly 3 years, still couldn't read their behavior. And his instinctive reaction is to hit them if they come too near to him. The big adults never had their tail raised, they weren't going to attack. They just came out from a swim. Nor would I trust a couple who thought putting makeup on a pet monkey to make money was ethical. But these very same people are running an orphanage now. Their cages are filling fast with captives smuggled out from Angkor Forest. And there is one dead mother already.